I never actually realized how much of a passive receiver of information I am, especially when it comes to health information. We always hear about breast cancer and breast cancer awareness, and there's a bunch of campaigns that go on about it, but I've never actually checked ever. So October is Breast Cancer Awareness Month. The irony, because I actually did not know, but I had my very first scan today. All good, nothing to worry about, thank God. But I actually discovered a couple of things that I completely had no idea about. And for anybody out there who may have any concerns regarding breast cancer or just, breast conditions in general, I think this particular video might be helpful for you. So like I said before, I recently found a lump last week on my breast, and of course I went to the GP, just trying to figure out what it was. From the GP, then I got referred to the breast clinic to kind of do that ultrasound to kind of figure out what it was. It was a small lump, so it wasn't big enough or firm enough for it to be alarming, for it to be considered breast cancer. But of course, we still went ahead and checked just to be sure. So I got to find out today it was actually fibroadenoma. I've never heard of that term before, ever. So fibroadenoma is a breast condition, but it's benign, meaning it's non-cancerous. Can usually occur in women in their 20s or their 30s. Women in menopause can also kind of experience it as well, but it's mostly common in younger women. Symptoms of it's usually quite smooth. It is painless, so you wouldn't really feel any pain regarding it. It can occur just before your period. It can show up just before your period, and of course it moves quite smoothly around your breast as well. It doesn't increase your risk of breast cancer at all, since of course it's benign. The only time that I guess you would have to worry about your risks of breast cancer is if maybe you do have those kind of signs that you need to look out for breast cancer, whether it's your lifestyle or your family history, or of course your medical history. So there's 5 different types of adenoma. Of course, you have the simple adenoma, and that's when you have, the lump that moves around quite easily. It's quite smooth, painless. You have complex adenoma. It's still nothing to worry about. It does not increase your chances of cancer. It just looks very, very different under a microscope. Then you also have giant fibroadenoma, and this is when it grows to more than 5 centimeters, because the simple one is usually under 3. And then you have juvenile adenoma, which usually occurs more in teenage girls. And then of course you can also have multiple fibroadenomas, which I also didn't know about. So the diagnosis process, should you ever find a lump on your chest area, of course you go to the GP. From your GP, then they would usually refer you to a breast clinic, where you could have a mammogram, an ultrasound, or a biopsy to kind of diagnose this fibroadenoma. When you're under 25, you are less likely to have a biopsy to confirm it. And when you are in your 40s, you are more likely to have an ultrasound than a mammogram. Right, enough memorizing of information for me for the day. That's all I could remember. I think it's right. I actually, you know what, I had a leaflet. They gave me a leaflet today. So when it comes to causes, because I didn't really want to give you all the wrong information, right? When it comes to causes, so it's thought that it may occur because of the effects of the hormone estrogen. So your breasts are made up of milk-producing glands, the lobules, and the tubes that carry milk to the nipple ducts, right? And these are surrounded by tissue that gives their breast their size and shape, right? And the fibroadenomas develop from the lobule. Tissue and ducts grow over the lobule and form a solid lump. Now, I might be showing my age, but honestly, when I read that, all I could think of was, oh my God, are my breasts growing? Because they're quite small, and about time they grow, really and truly. So I was really excited, aside from the seriousness of the situation, But yeah, it's a very, breast cancer is very, very serious, and we lose many, many women to it throughout the year. around the world. So I guess aside from the silly moments, do go and get yourself checked should you have a lump around your breast area, and check frequently as well for any changes around that chest area. But also I think I wanted to make this video to reduce fear around the whole topic, because like I said, for me myself, anytime a lump around the chest area is mentioned, I automatically think breast cancer. And for some people, that might prevent them from actually going to check because, you know, they don't want to know, they don't want to deal with that. But it's always better to be safe than sorry. But yeah, that was me and my first screening of my bosoms. But yeah, that is all about fibroadenoma. Do read around it yourself should you need to. Check yourself if you need to. And last of all, happy Breast Cancer Awareness Month. Bye.